to offer in the faculty. So yeah, I hope you enjoy. We really have put some effort into this to do our utmost best to provide you with information. Just a few house rules of engagement for tonight's session. Please always mute yourself. The presenters will be seen whilst they are presenting with the videos. Otherwise, we would ask you to not to show yourself with your video. Close your video or your camera so that the presentation can go smoothly. And then also during the relevant presentations, each and every department is going to present. So we're not going to acknowledge any hands during the session. There will be a formal question and answer session at the end of this whole presentation or whole session. But when each and every department presents, there at the bottom of your screen, there's a Q&A button, which you can just open up. And this is our question and answer platform where you can type your questions. And we've got a panel of experts that will answer your questions accordingly. And also the presenters of the different departments will do so swiftly afterwards they've completed their presentation. So thank you for that, and thank you for joining us tonight as well again. And then without any further ado, I'm going to kick off this session, and we're going to ask our Vice Chancellor, Prof. Francis Petersen, just to say a few words for you as well. Thank you very much. Thank you, Prof.
Thank you, Reiner. Good evening, ladies and gentlemen, and prospective COFSIs and COFSI parents. It is indeed a pleasure for me to welcome you to this engagement with the University of the Free State, and then in particular with the Faculty of Health Sciences. So I view this evening's engagement as an exciting opportunity to begin to establish a closer relationship with our prospective students in the health sciences, as well as their parents, their guardians, and their families, and whoever supports them this evening on this particular platform. I'm grateful for the opportunity for me to connect with you, and I trust that this will be the first of many such engagements. As with all parents, you are no doubt grappling with choices related to your children's post-school education, and that's not an easy task. Sometimes these choices can seem unnerving and sometimes also complicated. And it's for this reason that the University of the Free State has reached out to our prospective health sciences students and their parents or their guardians in the hope that we can provide insights into subject choices, career paths, and various tertiary education opportunities. We also hope to learn from you in terms of your questions, and as Ronald has indicated, there will be a time to ask questions, Q&A, but also concerns that you might have to provide clarity and guidance and hopefully also support when needed. So the University of the Free State has embarked on a new ambitious strategic path that will lead us to the year 2034. Yes, you have heard correctly, the year 2034. And in that year, the university will mark the 130th anniversary of its founding. Vision 130, which we sort of label linked to the 130, as I explained earlier, aims to take the University of the Free State to greater heights. And at its core, it is our intention to become a research-led, a student-centered, and a regionally engaged university that contributes to development and social justice through the production of globally competitive graduates. And hopefully once your son or your daughter enroll at the University of the Free State in the Faculty of Health Sciences, once they graduate, they would become that globally competitive graduate. But also globally competitive knowledge. So the key elements of Vision 130 include, firstly, academic excellence, and that's something that we won't compromise. So academic excellence, it's quality, and it's also impact. And secondly, it talks about societal impact with sustainable relationships. And thirdly, being a diverse, inclusive university. So as prospective students, consider your options for future in higher education. You can rest assured that the University of the Free State is on the path to strengthening our reputation as a university of excellence. We strive to be a university that values diversity amongst its students and staff, as well as what we call, and that might be a big word for you, epistemic diversity within the context of inclusivity in excellence. We aim to recruit and retain the best students from diverse backgrounds, and that's the reason why we're talking and engaging with you this evening. We regard our prospective health sciences students as an important part of this particular mix, and we value the ideas, the learning styles, and the work ethic of health sciences students and their contribution to the diversity and, very importantly, the values of the University of the Free State. So the leap from school to university is understandably daunting. As parents of prospective students, I'm sure you have many questions about what their university experience will be like. Will they be, first of all, be accepted to a health sciences qualification or program? And then once they're here, will they be safe? Will they cope with the pressures of university life and a health sciences degree? And which university will be a good fit and a conducive environment? We trust that we will be able to answer some of these questions this evening. And my colleagues in Student Recruitment Services are here to assist. Student Recruitment Services, led by Nomondi Mbadi, who is the Director of Student Recruitment Services, are your link to the university. And in addition to this evening's engagement, they will continue to be available to interact with you and to provide guidance. Student Recruitment Services is one of various units at the University of the Free State that is poised to assist, and our institutional support continues through the application process, to the admission process, and ultimately to the registration process. In fact, we also will follow you after the registration process to ensure that you complete your degree successfully. So the University of the Free State prioritizes student success. And once registered, our students are supported by our Center for Teaching and Learning. And that Center of Teaching and Learning work together with the faculty, so they in tandem. And the Center of Teaching and Learning is a leading center for student support nationally. Our Center for Teaching and Learning is constantly developing new research-led approaches to address teaching and learning in the 21st century and in the context of our fourth industrial revolution. Critical challenges facing higher education nationally, and I would probably say globally, include access to higher education, as well as success. We don't believe in a revolving door. Once you enter the university, is that partnership between the student and the university that will ensure the success of your son or your daughter or your relative. And we attempt to produce employable graduates with adequate skills to function effectively in the dynamic world of work. So for the University of the Free State, student success is not only defined by academic performance, although this, of course, is important, but it also includes the development of graduate attributes that enhance employability. We hold the view that creating an environment where students feel cared for and included is essential for effective teaching and learning. In addition to the Center for Teaching and Learning, our students also have access to ongoing support through units such as the Student Counseling and Development Division or Department, the Housing and Residence Directorate, the Health and Wellness Center, and the Center for Universal Access and Disability Support. And all of these entities are not operating in tandem or operating on their own. They're actually operating in an integrated manner. So we at the University of the Free State believe that our Bloemfontein campus, and that's the campus, it's the only campus among our three campuses that offer health sciences programs, is ideally suited to provide the health sciences students with an enriching university experience. So thank you again for attending this online event and for affording us the opportunity to engage with you, advise you, but also to learn from you. So as Vice Chancellor and Principal, I'm excited by the prospects of what I consider a budding relationship between you and the University of the Free State. I trust this evening will be informative and it will be interactive, and that you will leave feeling optimistic about your child's post-school future. And I would like to ask you that if you feel that we haven't responded to all of your questions this evening, that you should follow up with our student recruitment services that will put you in contact with the relevant individuals in the Faculty of Health Sciences. So to all of you, thank you and best wishes. Back to you, Reinhard.
Thank you very much, Prof. Francis Peterson. Thank you for that. Ladies and gentlemen, we're just going to continue with the program. I remind you again that at the bottom of your screen, you will see a Q&A button, question and answer button. Please feel free to post your questions for us there during the presentations. And in the end, after everybody's presented, we'll have a formal question and answer session. So we're going to introduce to you the School of Clinical Medicine, where Professor Nicholas Pearce, we're going to show a video of him that he pre-recorded for us, just to showcase the School of Clinical Medicine for you. Thank you very much, Barend.
To all potential University of the Free State students, I'm Professor Nicholas Pearce, Head of the School of Clinical Medicine. The University of the Free State is a 120-year-old institution that has a track record on par with well-regarded national peers, as reflected in the 2024 Times Higher Education World University and Impact Rating. The Faculty of Health Sciences is one of the few universities or faculties where the training environment, namely the faculty and the larger university, are all situated within walking distance. This allows our students to receive world-class education and experience a full university life. Sufficient evidence indicates that higher education has the potential to function as an agent of change and a means of serving the greater good. Although the mission of our university and our faculty has always been to equip our students with knowledge and skills needed to make a difference in South Africa and the world as a whole, we are also mindful that values are as important for you to make a difference in your communities. The UFS places great emphasis on ensuring that students have an outstanding university experience. In our pursuit of excellence, we are proud that our environment is conducive for intellect and knowledge to flourish. And as such, our values of excellence, innovation and impact, accountability, care, social justice, and sustainability are embedded in all activities within the faculty. As such, the University of the Free State School of Clinical Medicine, comprising of undergraduate and postgraduate courses, is small enough to care, but large enough to provide a holistic education. The School of Clinical Medicine offers 2 undergraduate courses, one in radiation sciences and the other in medicine. Last year, with over 16,000 applicants for a limited number of spaces, this enabled us to ensure we attract the best students from the country. The School of Clinical Medicine aims to select on academic merit and non-academic points that then are rated and selected in a fair and equitable manner. The School of Clinical Medicine requests that irrespective of what you undertake in the future, remember to pursue your passion and continuously have the desire to make a difference in the lives of others. The Faculty of Health Sciences aims at inculcating kindness, empathy, passion, and awareness of the real issues. If you want to tackle the unfinished goals of this country and create a better world for all, the School of Clinical Medicine at the University of the Free State is for you.
Thank you so much. So, as you heard, in the School for Clinical Medicine, we have two programs, and for the Bachelor of Medicine and Surgery, I'm going to hand over to Dr. Yolandi Swart.
Good evening to all of our guests. My name is Dr. Yolandi Swart, and I am the Program Director for the MBCHB program at the University of the Free State. Next slide, please. As you heard tonight, Prof. Pierce said that we have thousands of applicants every year. It's an exciting course to study. But I would like to give you an overview of how we go about selecting the students that will ultimately become our MBCHB students in the University of the Free State. So I will briefly talk with you about the admission requirements, the selection process, the careers that there is for your program, and what makes this university and the School of Clinical Medicine stand out in South Africa. So why MBCHB? It is a professional degree, and after 5 full years of full-time study, you will be able to call yourself a doctor. It is a program that is fully accredited by the Health Professions Council of South Africa, and we are recognized for our excellent training, not only our academic and support staff, but also our awesome training facilities such as the Clinical Skills and Simulation Unit and the Anatomy Lab. You will see at the bottom of the screen a QRL that you can scan to get access to our selection policy. So how do we go from 15,000 or 16,000 applicants down to the 180 that we actually have space for? First of all is that you need to look at your admission requirements, and this is all encapsulated within the selection policy. For matriculants and for senior students, it's slightly different, and I will now focus on the matriculants firstly. So in order to qualify to apply to the MBCHB program, you must have a minimum admission point of 36. So how does it work? It is calculated according to the 4 compulsory subjects in the National Senior Certificate Assessment. And that would be English or the language of instruction, mathematics, physical science, and life sciences. So those are the 4 compulsory subjects. And then we will also take into consideration the best 2 subjects on the designated list of school subjects passed. Life orientation with the achievement level of 5 or higher receives 1 point. So how do we work out the admission point? On the next slide, you will see, and it is also in our selection policy, a table that contains the NSC, the National Senior Certificate Achievement Level, and you will see that the grades are listed there from top to bottom, and then correlating to that, your UFS admission point. So if you had 88% for life sciences, that would give you a UFS admission point of 7. So just note that a minimum average mark at achievement level 5 is required for each of the following compulsory subjects: your language of instruction, mathematics, physical sciences, and life sciences. So even if you did amazingly at life sciences, but in mathematics you did not reach the level 5 achievement level, that will mean that you are not eligible for studying medicine. For senior students, the process is a little bit different. If you're a senior student who is studying for something else, but your degree you have not yet obtained, then our admission requirements are that you must have completed at least 1 year of mainstream course, and that you have achieved a minimum average mark of at least 70%. for all completed years. And this is if you are enrolled at a university. If you are enrolled at a University of Technology or another higher education institute, then your minimum average mark must be at least 75%. And you must be enrolled for the full curriculum as per the program. If you've already have a first degree, you have obtained it, you have graduated, then your requirements are as follows. It must be that you completed your degree in no longer than the minimum period plus 1 year. So if your degree has a minimum duration of 3 years, then you must have completed it in at least 4 years. As with the other category of students, your minimum average mark of all modules that you were registered for during the program must be at least 70% if you were enrolled at a university, or 75% if you were enrolled at the University of Technology or any other higher education institute. And you must have been enrolled for the full curriculum as per the program. So let's look now at the application process. If you look at these requirements and you realize that you do qualify to apply to medicine, then we go into the application process. Please note that our application dates are from the 1st of April to the 31st of May. So it is quite a short period of time that you need to do your application in. And I've added in for your URL code that you can scan, and that will take you directly to the landing site of the Faculty of Health Sciences application page, and it will guide you fully through the process. So how do we go about now? We have narrowed down all those who want to study medicine to all those who can potentially study medicine. So the selection process works as follows. Again, it is a little bit different for matrics versus senior students. In other words, students who have already started studying another degree or have obtained another degree. During the selection process, according to all the documents that you submit to us, you will be given an overall selection point. This is a maximum of 118 points for matrics and 107 points for senior students. And you can see on the screen how it is broken down. And again, in our selection policy, it is stated clearly. So 100 of those points are for academic achievement, and the other points are for non-academic achievements, your region of origin, and also if you are the child of a current UFS staff member. Once your overall selection point has been obtained, you are ranked according to that OSP. And I just want to note that that ranking is completely anonymized. The selection rounds are from August onwards, and it is by a selection committee. So during our first rounds, we will do a provisional selection. And at the end of the year, we will do a final selection. During the final selection, we make sure that you still meet the minimum requirements, that your marks remain approximately the same, and all required documents are submitted. Excuse me. Apologies to all.
Are you
Just
okay,
to,
doctor?
yes, thank you. One of those bugs in the throat that doesn't want to go away. So please note that the selected candidates who do not respond within the prescribed period will be taken out of selection. If you are selected, what happens now? You will enter 5 full-time study years, which consists of 10 semesters. That is 2.5 years preclinical and 2.5 years clinical. After that, you will obtain a degree, MBCHB, and you can call yourself doctor. However, you must still complete 2.5 years or 2 years of internship and 1 year of community service before you are able to register as an independent medical practitioner with the Health Professions Council of South Africa. The beauty of medicine is that it caters for absolutely every personality and talent. So if you're a person who loves people and loves to engage with them, it might be that you choose to become a general practitioner. If you're an adrenaline junkie and an on-the-go person, you might enjoy something like emergency medicine care or being a surgeon. If you don't like people at all, there's still a place for you in medicine. You can become a pathologist and sit behind a microscope for your working hours. Or if you're a sleuth and you love fidgeting around to find the answer to a question, then something like internal medicine or neurology might be the fit for you. So really, the world is your oyster. You can do whatever you choose. So why would you choose to study MBCHB at the UFS? We have an integrated model throughout our curriculum, including our assessments. And this is sometimes challenging for students, but the way that I explain it to them is that as a doctor, a patient will not come to you and say that I have heart failure. They will come complaining of coughing and saying they're out of breath or have swollen legs, and those things can be due to a number of reasons. And it's up to you to figure out through integrating all of the knowledge that we will give you during your training to make sure that you get to the correct diagnosis. What's lovely about the UFS is that we have small student groups, about 180 students per year that we select, and that means that you will have access to personalized advice, engagement with your lecturers and the module leaders, and also the state-of-the-art dissection facility and clinical simulations and skills unit that I've already mentioned. In addition, you will also have access to community-based education and interprofessional training on the next slide. You will undergo training in various facilities in Bloemfontein and the surrounding areas, which means that you are not going to be stuck at a single hospital. We will give you very wide exposure to all the different kinds of things that you can expect to see as a doctor. Then we also have excellent interdepartmental cooperation, and we have an emphasis on holistic student support. We know that MBCHB is a tough program, and we've placed various support structures in place, both academic and psychological, to make sure that you as a MBCHB student can stay the course and do it successfully and graduate a whole and healthy doctor at the end of your journey. And it is a journey, so I wish you all the best. For those of you who intend to enroll for MBCHB, we look forward to hearing from you. We look forward to seeing you, hopefully, and all the best with whatever you decide. Thank you.
Thank you so much, Dr. Swart. To the attendees and the learners, I just would like to emphasize, I can pick up a lot of questions in the Q&A that might be answered in the presentation that is going on. So please just make sure that the presentation is there, where we do answer some of the questions that is posted in the Q&A. We don't want to miss anything. So please also feel free to answer to post your question there, but most of the questions will hopefully be answered in the presentation. To go on with our second program in the School for Clinical Medicine is the Bachelor of Medical Science. I'm going to give over to Dr. Dieter van Eden.
Good evening, everyone. Thank you for the introduction. I'm from the Department of Medical Physics, also known as Radiation Science. And in tonight's session, I'll be talking about what are some of the admission requirements. We need an AP score of 30. So if you have 6 subjects, that will be a minimum score of 5. That's equal to 60 to 69%. And some of the subjects are English, mathematics, and physical science, also life sciences. And if you have a life orientation with an achievement level of 5, then that will only count 1 point. So if you have more than 6 subjects, sorry, on the previous slide, if you have more than 6 subjects, we will use the top 6 subjects to calculate your AP score. So in the selection process, we have a total of 15 students that is set as a guideline, and the merit list will be used based on the overall selection points, or the OSP. And also we have a different selection for school leaving and also senior applicants. It will be done separately. So for school leaving students, we have a maximum score of 118, where 100 of those marks are for academic achievements, some of the marks are for non-academic achievements, and then also we have 2 points for children of current university staff. For senior applicants without a completed degree, we have a total of 107 OSP marks, where 100 is for academic achievements, 5 is for the region of origin. We have 2 additional points that's also awarded to children of University of the Free State staff members. So a lot of people wonder, what is a medical physicist and what do you do on a daily basis? So we are involved in the application of physics in the practice of medicine. So it will be good if the student has an affinity for mathematics and also science. So we are divided into 3 different departments. It is radiotherapy, diagnostic imaging, nuclear medicine. We are also actively involved in radiation protection and of course academics, which involves teaching and research. So in radiotherapy, we use the testing and commissioning of radiotherapy equipment. We do routine and quality control tests on other machines. We are involved in the calculation of some of the treatment plans and also the facility design for the use in patient treatment. So radiotherapy involves the treatment of patients with cancer. In the top left, you can see that is example of a treatment plan. On the second image, you can see a linear accelerator. That's the machine that's used to treat the patients. And all the other images, you can see some of our equipment and our phantoms that we use to make sure that the output of these linacs are correct. Another department is nuclear medicine, where we do calibration and the quality control. We're also involved in development of isotope procedures to make sure that we have optimal images with the lowest possible dose to the patient, since they are injected with radioactivity. We also develop computer techniques for the calculation of isotope test results, and of course, very importantly, is radiation safety in nuclear medicine. So you can see there in the top left, that's an example of a gamma camera that's used to obtain these images. And then also we have a hot lab with lots of equipment and procedures that we perform daily to make sure that everything works optimal. So diagnostic radiology, this includes X-rays as well as CT, MRI, ultrasound, mammography. So we are involved in education for radiologists as well as radiographers in radiation physics. We once again do testing and quality control of all the equipment. We are involved in the facility design to make sure that radiation dose is minimal to the workers and the general public. And also sometimes we assist in the implementation of some of the diagnostic procedures. So diagnostic radiology, as I mentioned, involves CT, MRI, ultrasound, mammography, and all of our quality assurance programs ensure that the image quality for these modalities are optimal. So here you can see some of the equipment in diagnostic radiology. The top left, we have equipment where we will look at the CT numbers. In the middle are some equipment where we look at the radiation dose output of the CT. And also on the right-hand side, we will look at some parameters like the resolution and the contrast of the CT. So radiation protection is also very important, especially to develop some policies and education in the hospital. Also in the medical environment, we have to maintain the safety procedures. We have to control the radioisotopes that we use in nuclear medicine, and also control the radiation doses that are received by the patients, as well as the radiation workers. So what makes our department at the University of the Free State so fantastic is that we are currently the only department in the country that offers radiation science as a course. We are the strongest in research and outputs in the country. We have at the moment 7 PhDs, and also one NRF-rated professional, and we hope to have another one later this year. And we are very happy at the University of the Free State, and we would like to welcome all the students who would like to participate in medical physics or radiation science. And if there are any questions regarding what the work involves or anything regarding that mission, you are welcome to ask a question at the end of the session, or you can pop a question in the question and answer box at the bottom of the screen. Thank you very much.
Thank you so much, Dr. Dieter van Eden, for that presentation. That was now the School for Clinical Medicine. One of our other schools in the Faculty of Health Sciences is the School of Health and Rehabilitation Sciences. And I'm going to hand over to Prof. Cordia Jansen van Vieren to introduce to us that part of the faculty.
Thank you very much, Reinhard, and good evening to all the parents and all the prospective students joining us tonight. It's really my privilege as head of the school to just introduce the school, and after that, each of the departmental representatives.
Reinhard, sorry to interrupt. I think, Cordia, is your sound doesn't come through that strong.
Prof,
Yes.
did you get that, Prof. Cordia? Sorry, your sound is a bit, you're a bit soft.
Okay, is it better now?
Not much.
Is your speaker on the loudest
Yes.
setting,
A
Cordia?
little bit closer. Still not fine?
Oh, it's a bit better now, but yeah, I think you're gonna have to put everything into it.
That's fine.
Thanks.
I'll use
Thanks,
my
Prof.
lecturer voice. Better now. Okay, so
Yeah, sorry, it's a bit better, but you are still yeah, not that loud, but you're audible. We can hear. We're just gonna concentrate, so that's fine.
Okay.
Thank you.
Thank you, Reinhard. So yes, so I'm just going to introduce the school, and after that, each of the departmental representatives will talk about the specific programs. So the school is housed in the CR de Wet Bophelong building, where Bophelong really talks about life, health, and wellness. And in the school, we believe that it's those three things that really bind all of us together. That is the focus point for all 5 departments within the school. So at the beginning of this year, you can go to the next slide, thank you. So in the beginning of this year, we asked our first year students, why did they come to study at the School of Health and Rehab? And it is interesting to see that the word life came out again. Their dream of helping people, really wanting to help. Health came out. And we then realized that it's students with a very specific dream, and a dream that is really the same as our dream, is the people coming to our school. So for all the prospective students, if you sit with a dream tonight in your heart of helping people, wanting to change lives, then our school are definitely the place where you should be. So next slide, please. So within the school, we have 5 departments. It's nutrition and dietetics, exercise and sports sciences, physiotherapy, optometry, occupational therapy. And then we also have our own clinical skills unit. In that unit, we are really focusing on teaching practical skills, so that students are well equipped to move into the hospitals in the later years of study, so that they can then practice or use those skills in the treatment of real life patients. So each of these departments then also have their own HODs, and most of them has joined us tonight. So why do you then need to come to our school? So the first reason is the smaller classes. So we only select between 40 and 50 students per year per program, and that allows us to really do in-depth practical and clinical training. So all the professions within the school have a very big focus on skills training, and that's also why we have our own skills unit. That's also the reason why our graduates are really sought after in the job market, as we have these smaller classes and we have students that graduate with superior practical and clinical skills. Also, if we talk about our staff, we have 60% of our staff currently having PhDs or enrolled for PhDs or would enroll for PhDs within the next year. And we also have 2 NRF-rated researchers within the school. So really experts in their own fields and experts in the field that they are teaching. As researchers, they then also open the door for students to come back and pursue master's or doctoral studies in all the departments that we have in the school. Okay. So we also then, besides the clinical skills unit, also have practical and skills training facilities in almost all of the departments, where discipline-specific skills are then taught to all our undergraduate students. And lastly, can continue. We also have, just like Dr. Swart indicated, a very wide range of clinical settings where our students rotate. So it includes from placements at sport facilities, old age homes, hospitals, the community, in the Southern Free State at our Tromsburg campus, or satellite campus of the faculty. So we really ensure that our students get exposure to the full scope of practice of their specific profession, and it links back to the small classes, allowing us to really have a rotational system where students can get exposure to all the areas within their scope of practice. The next slide. So what are some of the frequently asked questions? And I hope that I can answer some of those questions now. So the first is the process of selection, and I've also seen in the Q&A a couple of questions about selection. So the students or applicants need to remember that there's more than one round of selection. So you need to stay in contact with us. Let us know if you had a specific first choice, do you want to keep that? If there's communication coming from the faculty to ask whether you would like to be considered in the next round of selection, please make sure that you answer that email as quickly as possible so that we can stay up to date and know whether you still want to participate in the rounds of selection or not. It just makes it much easier if we have contact with our applicants throughout the whole process. As Dr. Swart indicated, we also do our final selection only once the final results are done. But you just need to maintain the marks and still meet the minimum requirements as each of the departmental representatives will share with you. Then if it comes to study choices, and I've also seen a question about that in the Q&A, you need to also think about a second choice that is maybe one outside of the Faculty of Health Sciences. Because what could happen is that if both choices are within the Faculty of Health Sciences and you are not selected for one of the 2 courses, your second choice, like a BSc, might be already full and you might not get a position in that specific faculty. But as Prof. Piers also alluded in his video, make sure that it is something that you want to pursue, because you might also, as I saw other comments in the Q&A, not have a guarantee that the second time around that you apply for selection, you get that selection. So you please have to make 100% sure and think about your second choice as well. And don't just put anything in there just because you want to have a second choice on paper. Then remember that you will also have the opportunity to change your first choice throughout the selection process. Once again, extremely important to stay in contact with us. If you would like to change your first choice, also then make it very clear in your communication with the faculty. Can continue. Then meeting the minimum requirements. So a lot of the questions also relates to what if you don't meet the requirements now on your grade 11 final marks? Then you can still apply. You might not, or you won't be considered within the first selection, but you might obtain the subject requirements and the required APS score in your June grade 12 exam, which would mean that the moment you submit it, you might become eligible for selection within the school. The same might happen within your final exam. So you might then comply with the requirements, and we might consider you in the January selection after the final results have been submitted. So in this case, you also need to continuously update your marks and make sure that we have your most recent marks. The other question is to the other side of the coin. What if you don't meet the requirements after the final exam? Unfortunately, your selection will then be withdrawn immediately, and you will have to study something else. You will be eligible to apply again for the following year, but you won't be considered for that specific program. Then the best news that we've added, I think, for a lot of applicants this year is that for the 2025 student intake, so for the 2024 selection process, NBT test will not be considered in our school. So you don't need to go and write the NBT test to be considered for selection within the School of Health and Rehabilitation Sciences. So that is all from my side. Thank you, Reinhard. I'm sure that if there's any other questions, the departmental representatives will now answer a lot of that through their presentations. Otherwise, you are welcome to ask it at the end of the session in the Q&A. And then lastly, I'm looking forward to meet all of you in the faculty very soon. And good luck with your grade 12 year, the rest of this year. Thank you.
Thank you very much, Prof. Van Vuuren, Jansen van Vuuren. And thank you for answering some of the questions also in the Q&A. I think there's a lot of questions about the MBTs that you've answered now. And I think for the learners and the applicants, it's very important to familiarize yourself with the selection policy of the specific school and program that you apply for in the Faculty of Health Sciences. So for the Department of Optometry, the program Bachelor of Optometry, I'm going to hand over to Belina Makua.
Good evening, parents. Good evening, colleagues and prospective students. Unfortunately, won't be on the video this evening due to a few hiccups. My name is Belina Makua, and I'm excited to be presenting about optometry department today. So in tonight's presentation, I'll be discussing admission requirements. I'll also be discussing selection process. I'm glad that Prof. Collier already alluded to some of those things that I'll be talking about tonight. We're also going to look at the snapshot of the B optometry, the careers that we have in our program, and what makes our department stand out in South Africa. So why optometry? So here are the things that we teach our students to improve patients' vision. We also teach them to diagnose and manage a range of eye conditions. So we don't only focus on vision, but we also diagnose and refer patients with life-changing and life-threatening illnesses such as diabetes, high blood pressure, brain tumors, and others. So we also provide pre- and post-surgical care for various conditions and procedures, including cataracts, refractive laser treatments, as well as retinal problems. So that's just basically what optometry is about. All right, so for the admission requirements, for Bachelor of Optometry, a student, a learner is required to have a minimum AP score of 33. So because English is a language of instruction, you would be required to have 60%, which is level 5. So for other subjects, we also look at mathematics, life sciences, and physical science, in which mathematics, it will be 50% level 4 that is required. We also need life sciences, 60% level 5, as well as physical science, 60% level 5. So we have two programs, undergraduate program, which is a Bachelor of Optometry. It's a 4-year degree. We also have the postgraduate degree, which is a Master of Optometry. Next slide, please. All right, for the selection process, during the selection meeting, only applicants who have indicated this field of study as their first choice will be considered for selection. So if an applicant wishes to change his or her first choice, as Prof. Collier also indicated, should be done in writing to the Faculty of the Health Sciences, Student Administration, and that can be done at least 72 hours before the next selection meeting in the series of meetings. So the selection outcome is informed by the academic performance of a learner, and if a learner meets all the minimum requirements in the final NSC or IBE examinations. Next slide, please. And just to give you the snapshots of the optometry, B optometry program, which is the undergraduate program, as I've indicated earlier, I said it's a 4-year program. So the first 2 years of studies, these are the preclinical years. Here we cover the foundational modules such as the basic science, as well as the public health. And what's interesting about this program, we also start the practical optometry training in the first year of study, which will also continue to the second year of study. So this is where the students start to perfect their practical skills, and this happens at the clinical skills unit, as Prof. Collier has already indicated. So they do have space there, and it's fully equipped. The clinic is fully equipped, so whenever they have a chance, students can go there and just perfect their practical training skills. And then the 3rd and the 4th years, these are the clinical modules. So in the 3rd year of study, they mostly cover, they spend time doing primary eye care clinical, as well as we also introduce specialties within optometry. And when they get to the 4th year of study, they do both primary eye care as well as the different specialties. So beginning of this of each year also, we do provide to our students clinical orientation, and under the supervision of optometrists, we also send our students to different sites As I've indicated that we have the clinical skills unit where they do a lot of practice, but we also send our students to the hospital. We have the primary health care centers. We also send them to district as well as the tertiary hospitals. So here, that's where our clinical years or the third and the fourth year go. And they're able to, because it's at a different site, it actually provides them with experience, and they're able to integrate the knowledge that they've gathered from the third year of study when they start seeing patients. And they're able to communicate well in terms of writing as well as in verbally with other professionals, because we also form part of the multidisciplinary team. Next slide, please. All right, so the career options that we have within our program, at the end, you can work at the hospital. We also have private optometrists. We also have the part-time or locum optometrists. We also can go into research in optometry, consultant in optical industries. One can also be a lecturer, a non-government organization optometrist, as well as working with an ophthalmologist. Next slide, please. So why study optometry at UFS? As I've indicated, if you look at the structure of our curriculum, as well as the setup, including the equipment that we have, so this is one of a kind, and we are the leaders in the development of distinct eye care professionals and provision of comprehensive eye care services to the community. And thank you very much. I think this is the last slide, and we hope to see you and we'll answer the question at the end. Thank you.
Thank you so much, Belina. I appreciate that. Thank you for your presentation. To go to the Bachelor of Science in Physiotherapy, I'm going to hand over to Dineo Mahlangu.
Thank you very much, Reinhard. Good evening, parents, good evening, colleagues, and good evening, prospective students. I am Dineo Mahlangu, and I'm currently the HOD of Physiotherapy at UFS, but also I'm a physiotherapist by profession. So I look forward to seeing the future physiotherapists that will be joining us in 2025. Thank you. Next slide. Okay, so I think what I thought is first we need to acquaint you with what exactly is physiotherapy, because I think some of the encounters that we've had with our first year students is that they come to our institution and they're not really sure what a physiotherapy does. Most people are very familiar with the person that runs on the field, but they do not know that the physiotherapist is broader and more diverse than just the sports physiotherapy that most people know. So physiotherapists, they assist individuals with movement disorders and other physical conditions where we use various methods like exercise, manual techniques, rehabilitation techniques as well, electrotherapy, massage, adaptive equipment, health education, and advocacy to promote the well-being of the patient. In the course that we present, we study medical causes. So we include anatomy, neuroscience, physiology, and physiotherapy science in order to develop a theoretical knowledge that will promote better practical skills and encourage critical thinking to be able to be applied in clinical application. Our goal as a department is to improve, or as physiotherapists, is to improve a patient's physical, psychological, social well-being, and promote independence in the community and the quality of life. Thank you. Next slide. So with our admission requirements, I think Prof. Corlia has covered most of the things that we do look at in terms of what our school focuses on, but specifically for physiotherapy, we offer 3 different areas of the program. So we have the undergrad level, which is the BSc Physiotherapy, which will then take 4 years to complete. And within that 4 years, the student will have 2 years of preclinical and 2 years of clinical years that they have to complete. Then we also offer an MSc and a PhD in physiotherapy. So it doesn't have a specific focus as a degree, but within you studying that specific degree, you can actually choose the area of interest that you want to focus on, which I will also discuss a bit later. And then focusing on those areas, you will then become an expert or a specialist in that specific field. So for undergrad, we mainly focus on the admission. Your AP score should be 33. And the main subjects that you kind of need to meet the requirements for are English, because that is the corporate language, the primary language of medium of instruction at the UFS as well. So you would need to at least obtain a level 5 for English.
Sorry.
Mathematics, we just need a level 4. And then with life science and then physical science, you need to also have obtained a level. Can you hear me, Reina?
Yes, yeah, you're
Yes.
audible. So you went away for a while, but you're audible again now.
Oh, okay. I think maybe it's just a connection issue. Sorry for that. And I think just to emphasize, when we do the selection for these people, you need to have obtained all the minimum requirements for you to be selected for physiotherapy. So if it happens that you have an AP score of 33, but your mathematics is not a level 4 and it's a level 3, or your life sciences is a level 4, then you do not meet the requirements, and unfortunately, you will not be accepted into the program. Thank you. Next slide. Okay. Then our selection process, it follows a holistic approach, which is based on academic achievement, your leadership, cultural and sport activities. And in this process, we make sure that that we are fair and there is no bias that is being exercised. It's being done at different levels to ensure quality purposes as well. So you will have a selection that is done at departmental level, then it will be reviewed at a school level and also at a faculty level. So there is no lecturer that specifically chooses a specific student. We have to make sure that we are doing it based on the process that we have set for the requirements. And then also communication will be made from the Faculty of Health Sciences regarding the status of your selection. And like they've mentioned before, you will first get your provisional acceptance, and then only after the final results that you get in January, you will get the final status of your selection. And I just want to add there as well that as a department, there are departmental representatives that also make communication with you after you have received your final result to ensure that the people that have been selected are being prioritized in terms of the admission or registration. Thank you. Next slide. Okay, and then which careers would you be eligible to study after your 4 years of studying at UFS? First, you need to know that you need to complete a community service year for 1 year at any public healthcare institution in South Africa. And then from there, you can actually choose whether you want to be working in private sector or in public sector. And the different areas of physiotherapy that you can specialize in or that you can be working within include neuromusculoskeletal, so where most of the patients would be having your more joint problems and pain, or your cardiorespiratory, where you work in ICU or you're working in a burns unit, medical and surgical units as well, where we have orthopedics as well. So it's more your more bone injuries or people that broke their bones, and they're doing it whether it's post-surgical or pre-surgical. Then we have the pediatrics, so where you work with the children. And then we also now focus on gender-based health. So whether you're going to be teaching prenatal, postnatal, or people that have various cancers, even in cervical cancer or prostate cancer. So you will be working with those types of patients. Then we also have a very big focus on community-based rehabilitation. So in that area, we will be working in the schools, we work in old age homes, even in the community clinics. And then also the most popular one, the sports, injuries and prevention. You can also go and focus more in that area. Then there's also the area of neurology and mental health. So like I mentioned before, these areas are also areas that you can also focus your postgraduate research in. So if you decide that there's a specific area that you associate with quite hectically, then that's the one that you choose, and that's the one that you will go with. Next slide. And then you can ask yourself, why physiotherapy at UFS when you can do it anywhere else? So the quality of our academic program, it tends to promote integrated learning. We ensure that your educational journey is filled with learning opportunities, personal growth, and professional development. Through the passion of our staff and the passion that we promote in physiotherapy, we tend to facilitate you towards excellence and towards being a competent physiotherapist that you can be proud of when you are providing the service in the community of South Africa. Thank you very much. We look forward to seeing you, and we look forward to hearing from you, and we will be answering any questions should you have any. Thank you very much.
Thank you very much, Daneo. I just want to make the attendees aware that you did register for the webinar. So we do have your contact details, and the recording will be available that we can send to you after our session tonight. So for the Bachelor of Science in Dietetics, I'm going to hand over to Dr. Lucia Meku.
Good evening, can you hear me?
Sorry, Doctor, your sound is very poor at the moment. Let's try again.
Okay, I'm just going to move closer. Sorry, I'm having connectivity issues. Let me see if I do this. Can you hear me?
Yeah, there's a bit of an echo and a bit of a hiccup of the sounds. It's not very clear.
Not sure what to do.
But perhaps you should just carry on, Reinhard, and then see if it becomes not audible, and then we could ask her maybe just to stop. But in the meantime, I think she could carry on. Thanks, Lucia.
Okay. Thank you, Dr. Lucia.
My apologies about that. But I do hope you can at least hear a little bit of what I have to say. So welcome to the Department of Nutrition and Dietetics, and thank you for your time this evening. Next slide, please. So in tonight's presentation, we will cover the admission requirements, selection process, careers for your program, and what makes our department stand out in South Africa. Next slide, please. So for most people, the thought of a dietitian comes with the idea that we work with weight loss. However, as dietitians, we work in different fields and in different areas. So as a dietitian, you may find yourself working in therapeutic nutrition, particularly based in hospitals and sometimes in healthcare centers. As community nutritionists, you work in public health sectors and primary health facilities. We also have a leg called food service management. We work in research, and there's sports nutrition. In terms of our program as a student, you will be exposed to learning about genetics, about physiology, biochemistry, pharmacology, and microbiology. Next slide, please. So what does a dietitian do? As a dietitian, we apply the science of food and nutrition to treat and prevent disease. And so part of that involves developing feeding plans and menus for hospitalized patients. It also involves providing nutritional guidance and developing eating plans for people that suffer from infectious diseases and also from non-infectious illnesses. Another role of a dietitian is that we provide guidance on optimal nutrition, in other words, healthy eating to the general population, but we also work with general eating guidelines in people participating in all different types of sporting codes. Next slide, please. So our admission requirements, quite similar to everything that has been said in physiotherapy and optometry, and also by Professor Corlia. So for admission into the Department of Nutrition and Dietetics, we require English as a subject on level 5, mathematics on level 4, physical science and or life sciences. So what that means is that if you do not have either physical sciences or life sciences, but you have one of the two, you are still eligible to be selected into the program. Next slide, please. Our selection requirements, our AP score is 33, and points are awarded for the subjects as indicated in the previous slide, that is English, mathematics, physical science, and or life sciences. We take the best school subjects up to a total of 7 subjects, and only 1 point is awarded for life orientation for an achievement of level 5 or higher. Next slide, please. So where can a dietitian work? There are various areas and various institutions where a qualified dietitian may work. And fortunately, with many of our graduates, you may work locally in South Africa, but you also may work internationally as well. So it depends where your passion lies. So primarily, dietitians work in hospitals, and that can be public or private hospitals. And in private hospitals, you work as a private practicing dietitian. Other areas where a dietitian may work include rehabilitation centers. You may work as a representative for pharmaceutical companies, predominantly those that work with nutrition and nutritional products. You may work in research institutes and become a researcher, and this may also be in government departments where there are posts for researchers. You as a dietitian may work there. You may work in retirement homes. Mines have also had dietitians work on their staff complement, and you may work in various other non-governmental agencies as a consultant. Next slide, please.
Welcome to the Department of Nutrition and Dietetics at the University of the Free State. Dietitians play a crucial role within communities to promote health and prevent disease.
There are various job opportunities within dietetics that don't only involve creating a meal plan and helping people lose weight.
You can become a therapeutic, clinical, or community dietitian. You can follow a career in research or go into the sports nutrition field. You can become a dietitian in a food service unit like this one right here.
But why choose to study at the UFS?
At the University of the Free State, we have amazing lecturers that are all registered dietitians and specialists within their respective fields.
Our lecturers are highly motivated to make sure that we reach our full potential. They are here to mentor, to listen, and to guide us through our journey.
The focus isn't solely on academic achievement, but also practical education.
With various service learning opportunities and work within hospitals and the community, you learn valuable skills which will prepare you for real-life situations.
There are some difficulties you'll face during your time as a student, but with your lecturers and friends in your class, you'll always have a strong support system to fall back on. We aren't a very big department, but within our smaller department, we are able to create really good relationships with each other. We are able to share our experiences, which provide us a diverse perspective of our country, and we are able to provide emotional support to each other.
Within this department, your voice matters. Students are given various opportunities to voice out their opinions and share their concerns.
Here we treat each other with kindness and respect and take pride in creating an environment that feels like home away from home.
So with that being said, that was just an explanation of why you should come and study with us at the Department of Nutrition and Dietetics. However, we do look forward to welcoming you and seeing you in our red uniform, and we hope to see you soon. Thank you very much.
Thank you so much, Dr. Lucia. In that went well. Thank you very much. For the Bachelor of Occupational Therapy, I'm going to welcome Monique Strauss.
Good evening, everyone. Thank you for attending tonight. My name is Monique Strauss. I'm a lecturer at the Department of Occupational Therapy, and it's just a privilege for me to share some information about our department with you. Next slide. So to answer the question, why occupational therapy, I think it's first important to understand what is occupational therapy. So it's quite a linguistic issue, because many people think, occupation means you work with people who work. Well, it's only one part of it. So when the lens of the occupational therapist, when we look at occupation, it's more than vocation. Occupation to us is all the daily activities people engage in to give their lives meaning and purpose. So whatever is important to you, we see that as your occupation. And these occupations are acted upon alone, in groups, in different contexts, wherever you are functioning every day. So in occupational therapy, we believe that if you can engage in activities that's meaningful to you, you are healthy and you could live a life of well-being. So the science that occupational therapy is built on is the science of activity. So it's about analysis of activities, how people engage in activities every day, what we do, how we do it, what is meaningful, what is important for human engagement. And then, so we call that occupational science. That is the basis of our science. And then also we also include other basic sciences like psychology, anatomy, physiology, and other sciences. Next slide. So to repeat myself, we thus see all activities that a human participates in, like playing, attending school, education, work, that's the one occupation part, sleep, social participation, all activities that you engage in, like your self-care activities, managing your health, your recreation activities, all it forms part of your of the scope of occupational therapy. So in occupational therapy, in groups and individually, we strive to get people to engage in activities that's contextually relevant to them, that's important to them. So how do we do this? What types of intervention do we provide? So firstly, we provide intervention through activities. So through the science of activity, we teach students how to adapt and design activity and engagement in such a way that it enables other occupations. So we talk about using occupation or activity as a means in order to have the participation also as an end. Right, so that's for the activity part. So we really teach the students how to design. It's a design science. Then we make use of specialized techniques that is developed from science, that has a strong scientific base. We make use of very therapeutic apparatus in interventions, assistive devices like adapted eating devices, wheelchairs, dressing devices, and mobility devices. And then also splinting is a very big part of our profession, which is more linked to the hand therapy. Next slide. So if you want to become an occupational therapist, how do you do it? So firstly, when applying anyone, we accept applications from a variety of educational levels. Grade 12 learners may apply, enrolled students, as well as graduates. We predominantly select South African citizens, but a maximum of 2 international students can also be selected per year. The required subjects are English, mathematics, and then either life sciences or physical sciences. So you can either have one of the two or both. And an AP score of 33 is required. Next slide. So what are the minimum requirements in all these requirements? What are the minimum required in each of the performance levels that you need to achieve? So firstly, for English, you need a minimum achievement level of 5, mathematics level 4, life sciences level 5, and physical sciences level 4. So when applying for occupational therapy, you will firstly apply with your grade 11 final marks, your December exam marks, by the 31st of May. And then also, as soon as you get your grade 12 June exam marks, you also submit that, as we consider that in the selection process. Then a medical certificate may be required in specific instances, which declaring the applicant's health status or any disabilities, if it's relevant. And then, if you are a serious student and you want to apply, please contact the faculty for more information, as there are additional requirements that's applicable. Next slide. Right, so further about the selection process, we select a maximum of 50 students per year, and these are the 50 students who obtain the highest selection score. And that is entails many types of criteria that is predefined that you'll get in the selection policy, but we follow a holistic approach, allocating points for academic achievement as well as non-academic achievement, including cultural activities, leadership and sports activities, according to a specific selection criteria. And as mentioned, you apply with your grade 11 December exam marks, then you also submit the grade 12 June exam marks, but if you are selected, the applicant should maintain the presented academic performance and still meet all the minimum requirements to retain selection after the final national certificate exam. That is very important. So if you're an occupational therapist, where can you expect to work? So a UFS qualified occupational therapist can work in the following sectors in South Africa as well as globally, as our degree is internationally recognized. So you will find an occupational therapist firstly in the health sector, the private and public health sector, in community sector, in community hospitals, in secondary hospitals, as well as tertiary hospitals. Then in educational sector, where you'll find us in special needs schools, the Department of Education, the district-based support teams, as well as occupational therapists working in private practices in schools. And then also we practice in the commercial sector, where we do assessments for insurance claims, in the mining industry, as well as in other legal sectors for functional capacity assessments and work assessments. Then the population we serve, that's so amazing that when you're an occupational therapist, you really work with the spectrum. We see patients in groups, as individuals, as well as in communities. So we also do community health, and we see right from a baby, children, adolescents, adults, to older adults. Then the type of approaches, occupational therapy has a diverse approach to healthcare that we follow, as we are very holistic in our approach, ranging from physical health and rehabilitation, mental health, we have a strong sector in mental health, community health, and community development with a lot of projects, then developmental impairments of all age groups, developmental groups, and then also very strong work assessment and rehabilitation component. Then there's also occupational therapists working in social development, where we work in non-governmental organizations, old age homes, and in other residential and support care facilities like children's homes. Next slide. So why choose UFS OT department? So firstly, our staff establishment is very innovative and very diverse, and each one of us have expert knowledge in our specific field. And then we are all very committed to student success and base our content on the latest research. Then our department has a very strong student support leg. Because we are a very small department with not a lot of students, we really have a daily contact with our students, facing them daily, having relationships with our students. And we have an open door policy. And with all the support structures in place, the students are really welcome, and they do make use of it to approach us for support. And we have many structures in place for academic support, social support, and psychological support. And then we are so fortunate to really have adequate resources to supply a variety of innovative learning and teaching techniques. The venues, the lecture venues are wonderful, and we also are very proud of our simulation unit that we actively use for simulations, which creates a very safe and high technology simulated space where our students can practice their clinical skills in a safe environment, make mistakes where they get assistance before they go to clinical, which makes them feel very safe, and it's a very big strength of the department. Next slide. Then also our lecture venues are very close to each other within a secure environment, so the students can walk from the one venue to the other within minutes. In Bloemfontein, we are really fortunate to have the clinical fieldwork practice areas very close to the university. So enabling our students to reach all the prescribed areas, to reach the prescribed clinical hours for them to qualify. The school also provides safe, reliable transport to all the clinical areas, which is wonderful for the students. If the students need to visit the clinical fieldwork area outside Bloemfontein, safe accommodation and transport is provided to the students. Next slide. Then lastly, we are fortunate to have a robust, integrated, interprofessional, community-based clinical platform where all the learning takes place. And that ensures that our students are ready to serve the community's needs as equipped therapists, which we want, members of the interprofessional team, and then lastly, and very importantly, responsible citizens. Thank you for giving me your time, and if you have any questions, you are welcome to contact the department. Thank you.
Thank you very much, Monique, for that presentation. For the Bachelor of Biokinetics, I'm going to hand over to Leeson Farland.
Good evening, everyone. I'm Leiken Farland, the Program Coordinator for Biokinetics, as well as a lecturer within the Department of Exercise and Sports Science. You may move over to the next slide. So what exactly is a biokineticist? A biokineticist is the exercise specialist that will function within the professional alliance within the health and medical sector. We are recognized and registered with the Health Profession Councils of South Africa. We also form part of the multidisciplinary team within the medical team as well, where we specialize in the preventative medicine. So for us, exercise is medicine is really one of the things that we take quite literal as well, and we come more into play during the final phase of rehabilitation. So throughout the 4 years of study, we will give you the necessary tools as well as the skills to provide that final phase rehabilitation. So for the first 2 years within our program, that is the preclinical work, here you would really learn more about the foundational knowledge as well. This can include modules like your anatomy and physiology, motion, and also baseline evaluation testings. You will also begin to be exposed to the work integrated learning within the first 2 years of the program as well, where it would mostly be just observation. When you do move over into your clinical years, which is year 3 and 4, there you will specifically look into the various musculoskeletal injuries as well as the chronic conditions as well. So there we will provide all the necessary skills so that you can do all the diagnostic testings and then also all the tools to rehabilitate all of these conditions. It's also within your clinical years, so year 3 and 4, where you would rotate in various private practices within the city as well, but as Mrs. Strauss just mentioned now, the faculty do supply the transport for you to go to all the various private rotations as well. So all of this will help you to improve a patient's physical status and the quality of life through individualized evaluations, specifically making use of scientific practices to provide the exercise prescription. So if we look at the admission requirements for biokinetics as well, very importantly to note, for intake of 2025 students, the AP score is 30 from this year's applications as well. So if you do look at the minimum requirements that you need to meet for the National Senior Certificate, you need your English on a level 5, so that is 60%. Your mathematics should be 50%. Then you also need a physical and or life sciences, a level 50%. Over to the next slide. So as everyone has mentioned now already, there are various selection rounds from the middle of the year after applications is closed until next year, January, when final NSC and IEB results are available. Important to note, for the biokinetics program, the closing date for applications is only the 31st of July. So you still have sufficient time to apply as well. So if we look at just your matric learners as well, so you will apply with your grade 11 results, and as mentioned previously as well, as soon as you have your grade 12 results, the June results, you can send it to the faculty's student administration as well. If you are already within any higher education institution as well, there are further requirements for you as well. So if you are enrolled for a accredited degree program, you need an average of 65%. If you are enrolled for a diploma degree, you need an average of 80% through all the study years. It is important that you need to be at least registered for 120 credits. So if you are within extended program, you would only need to be able to apply and be considered if you are within the mainstream year of that extended program. And then very important to note that preference will be given to applicants enrolled in a related study field of biokinetics. If we move over to the next slide. There are various careers and opportunities within our profession as well, but most of our students, when they are now qualified biokineticists, work in private practices. So you can either begin your own private practice when you are done with your degree, or you can work at someone else's private practice. Then you can also work at various rehabilitation units or schools for children with special needs. Here, your role will really be to maintain the functionality of these people and also to improve their quality of life. You can also work in various corporate sectors or various government departments where your focus will mainly be on health promotion and wellness of these employees. Then for all our sport athletes and sport lovers as well, you can work within various professional sport teams or then within the school systems as well, where your focus would be on the rehabilitation of those athletes as well as the conditioning of those athletes. Over to the next slide. So what makes our department really stand out, and specifically the biokinetics program as well? So previously, before we had the Bachelor of Biokinetics program, we had the Human Movement Science program, where it was a 3-year undergrad degree, where students still needed to complete a 1-year specialization honors degree, and then you still needed to complete 1 year of internship. So for us, we were the first department within the South Africa education space to offer the new 4-year professional degree, where you will now qualify and be registered as an independent practitioner at the end of your degree, where you do not need to do any internship program. So for us, I think throughout the whole 4 years, we really believe in creating leaders and vital collaborators within the healthcare sector. You will also experience this right throughout your study as well, whether it's the interprofessional education with other students within the faculty, or then the School of Health and Rehabilitation Sciences community-based education projects as well. We are also one of the smaller departments within the School of Health and Rehabilitation, so we really provide the needed support to our students, whether it's additional academic support or then other services that they might need, so additional social support or then health services as well. So we really do ensure that you get the necessary help to help you go and successfully complete your degree. We also have a lot of students who are athletes as well, so we really try to accommodate these students as much as we can when they are away for competitions as well. So in a nutshell, that is the Department of Exercise and Sports Science, specifically the Biokinetics program, and we look forward to seeing you hopefully in 2025. Thank you.
Thank you very much, Laken, for that presentation. For the Bachelor of Sports Coaching, I'm going to hand over to Mark Nichols.
Good evening, everyone. Trust you're well. My name is Mark Nichols. I'm also from the Department of Exercise and Sports Sciences, and I have the privilege to present the sport coaching degree to all of you. Okay, next slide, please. Okay, so what is sport coaching about? I think that's very important. Obviously, could be straightforward. It's the coach that obviously gets everyone to do what they're supposed to on the sports field. But let's have a quick look here. So sports coaching is a profession these days. It's quite professional in most aspects of sport. It's a profession concerned with the development, improvement, and maintenance of sport abilities and skills by means of scientifically based program prescription, physical training, and support. So it's become way more scientific these days. So the Bachelor of Sport Coaching will make a significant contribution to the development of centers of coaching excellence in South Africa, and also the professionalization of sport coaching, as I mentioned earlier. I will still later on speak about the career opportunities, but if you think about it, obviously you could coach from various levels, from the recreational aspects all the way up to high performance sport or elite sport. You can be a coach educationist, really be someone coaching the coaches. You could be in the school setup where you're a school sports administrator, either a coordinator or perhaps the director of sport at school level. And then obviously you can also work in government sectors, as well as perhaps being a recruiter or a sports agent. Okay, next slide, please. If you look at the admission requirements, first of all, you need an AP score of 30, and then basically you need either English or Afrikaans at level 4, 50%, and then there's particular recommendations with regards to other subjects. If you look at maths at a level 3, 40%, or then math lits at level 6 or 70%. And then physical sciences and life sciences at level 3 at 40%. Those recommendations are merely there because obviously those subjects will help you in obviously handling the content of the modules within the coaching degree. Next slide, please. Okay, if you look at the application process, I think it's very much similar to all the colleagues that have spoken before me. But if you look at it, you'll follow the general UFS application process, and the closing date is the 31st of July for the sport coaching program specifically. We obviously look at your matric marks, but then there's also consideration into your sport participation, because ideally we would love to have students that's obviously passionate about sport and sports coaching specifically. Okay, and then like my colleague Farland has mentioned, there are various rounds of selection that take place. Obviously, we look at your matric marks, and if you've made it through the first round and you've been selected, then you just need to maintain your marks, and obviously you will get selection into the program in 2025. However, if you haven't made it through the first round, you can obviously continue working hard, and then if you do make the requirements, you can still we could still look at your application, and you could be on that list in the new academic year in 2025 if you adhere to the requirements. Next slide, please. Then if we look at the career options with regards to sport coaching, or the career options that stem from studying a degree in sport coaching, it's obviously quite obvious. The one option would be to be a coach, like I've mentioned earlier, at various levels, whether it's at school level or recreational level, all the way up to high performance or elite level. You could become a master coach, as the third one is referring to there. I'm thinking of various people here at the University of the Free State in, as she's affectionately known, in Tanny Ans, who produced Wade van Niekerk, and then there's various other coaches. I was privileged to be part of the Varsity Cup side that won the Varsity Cup last week Monday. So there's various master coaches that you will be exposed to in various sporting codes as well. So you could become that coach yourself, obviously, in future. Then another option with regards to a career option would be a strength and conditioning coach. So sports conditioning. If I say strength and conditioning, we talk about obviously working with the athletes in the gym, but also on the field with regards to their fitness. Then you could also become a sports manager, obviously looking at more the admin side of things in a sporting context. And then also you could be a sports organizer, either at school level or at other institutions. Teaching positions. You could also, a lot of the students that do study sport coaching, they do end up at schools, especially when you do additional subjects and you pursue a PGCE or your postgraduate certificate in education. You can obviously become a teacher, and you can even run the sports program at the particular school. And then obviously you could also be an athletic scout and trainer. You could go into recruitment for a specific sport, whatever the sport might be. And then lastly, you can become a sports development officer, or just go into sports development in general, again, at various institutions, whether it be school or wherever else. Okay, next slide, please. So what makes us special in terms of offering this particular degree? I think it is quite special in the fact that we were the first university, first department with regards to exercise and sports sciences that took up the offer when the South African Sports Confederation and Olympic Committee put up the challenge to institutions to come up with a degree. And so we were the first to offer the degree in sport coaching. And this particular degree is obviously aligned with the International Sport Coaching Framework to make sure that obviously the students are exposed to all the aspects that's necessary to make them the best coaches that they can possibly be. And then lastly, obviously, it's all about, in our context, it's about the practical side of things with regards to sports. So it's all about bringing science into play. So we make sure that, like I've mentioned, we look at all the aspects with regards to being a good coach, and also to all the aspects that an athlete will need to be the best in a particular sport. So our main aim is to bring science into play and to make sure that we can implement it in a practical way. And I really do look forward to anyone that is passionate about sport, and especially sport coaching. We really do look forward to seeing some of you here at the University of the Free State. Thank you very much.
Thank you so much, Mark, for that. Ladies and gentlemen, we are almost coming to the close, or the final stages of the evening. So the last school is the School of Nursing. I'm going to hand over to Anna-Marie Wellman.
Good evening, everybody. Yes, like we are saying, we are the last one, or the last presentation, but that does not mean that if you are still interested in us, then okay. So let's talk about nursing. So why us, and why the UFS? So specifically at the School of Nursing, we are really committed in providing a nurturing environment for you. And it's about your academic, professional, and personal development. And I am the first year lecturer, as well as the current acting program director. So I must say that the first years are really what's important. We also have a state-of-the-art simulation facility. And if you are interested in us and applying, then you can also contact Mrs. Klopper, who is really the person that works with the applications. Next slide, please. So where are we? We have different venues on campus, which specifically includes the Idalia Loods building, the Benedictus Kok building, which is where most of our practical training occurs, and the NARS building, which is mostly used by the postgraduate students for research. So when you apply and when you're looking for us, please use the Idalia Loods building. Next slide. So you've heard a lot about admission requirements and different AP scores. So we specifically look at the National Senior Certificate. And it's important that you collect the Umalusi certificate from your school, because this is required by the South African Nursing Council, which is our governing body. And we look at specific subjects as well as achievement levels, and our AP score is 30. You need to complete a health questionnaire, but luckily no NBTs are required. And there's also some extra things that you need to budget for, which is your uniform, the transport provided by the university and the faculty, indemnity, immunizations, as well as books. Next slide. So what are we looking for? Specifically English level 4, which is your 50%, your mathematics, which is at a level 3, but we also accept math literacy, which is at a level 6, and then either life sciences or physical sciences, which you would have noticed is across the faculty most important. Next slide. So we have online applications, and that's how you would apply. We are closing the applications on the 31st of July, so you still have a little bit of time. Please try and make your applications as complete as possible, because no late or incomplete applications will be processed. And it's important to please select the Bachelor of Nursing as your first choice. We also ask that you are truthful when completing the health questionnaire, since we might ask you to provide further proof of your health status. And this is not to say that you won't be successful. It's just to really indicate that nursing is a physical job, and it's important that you are healthy and that you are able to do this. Next slide. So how does the selection process work? Provisional selection. We would like you to submit your final grade 11 or grade 12 June marks. So you still have a little bit of time if your June marks looks better. And then we will confirm your final selection based on the grade 12 marks that are published next year. Like I said, we might ask you to submit a medical report if applicable. We will inform you of your selection via text message or emails, and you can expect that information and that email by late August or early September. We really are a very popular school. We received more than 30,000 applications for this year, and we can unfortunately only select 75 students. This is currently a requirement by the South African Nursing Council, which is our governing body. Next slide. So for the undergraduate program, you will do a Bachelor of Nursing, which will give you a qualification as a general and midwife, general nurse and midwife. So that also means that if you have a passion for midwifery, that would qualify you for that. Currently, the other qualifications that is available is a diploma in nursing, which only gives you a general nursing qualification. We offer this program over a period of 4 years. And after that, as with all the other programs, you need to complete a year of remunerated community service or an internship. I must say that our students are really placed everywhere. One of our top achievers is currently doing her community service or intern year in Jeffreys Bay. So you do not necessarily have to stay in the Free State. You can really go anywhere. And this year of community service helps you transition into the role of a professional nurse, which is the qualification that you will be registered for at SANC. So where can you work if you study with us? Well, there's really national and international opportunities available. You can either work in a private or public hospital, clinic, retirement village. So there's really a lot of options available, which includes your wards in the hospital, your ICUs, your pediatric care, which I think a lot of my students actually want to do. You can even work in theatre, emergency care for those of you that are adrenaline junkies. There's also mental health, which is your psychiatric care, midwifery, and the primary health clinics. Next slide, please. So how does this work? So within the School of Nursing, you will start with your undergraduate degree, which is the third circle. From there, you will go to your postgraduate diplomas. So that is the diplomas that we currently have for, we talk about the legacy programs and then the new programs. So the Bachelor of Nursing is actually considered as a new program in inverted commas, because this was commenced in 2020, and that gives you the qualification as general nurse and midwife. So the postgraduate diplomas includes mental health, health services management, your primary care, your occupational health, and those are presented by different universities, but we currently have quite a few options available as well. And then your postgraduate degree, which we all want you to complete, including your master's and PhD. And then we also have short learning programs, which is the last circle, and that focuses on professional nurses that would like to upgrade their skills. So there's really a lot of options available at our school. Next slide, please. So why us? You've heard a lot about simulation, and that it's everywhere in the faculty, and it's available at every school. So how we use simulation is that we place the students in a simulated environment. They work as a group, and it's actually quite intense in terms of we observe you, but you are responsible for that patient's well-being. So it includes standardized patients, but also high fidelity simulation. So if you ever have the chance, especially during the open days, come and have a look at what we have and the mannequins that is available. We also have a mannequin that can give birth. So we use this very effectively to simulate and prepare students for what they will experience while placing in the hospitals. We also have structured engaged scholarship projects. So these are community projects which already starts at first year level, where you work in an interprofessional team. So you are exposed to occupational therapist students, physiotherapy students, even language practice students, and you engage in research activities where we want to address the needs that we see in the community. We really have qualified teaching and learning staff that are really supportive. If I think about what's currently going on, I have 2 undergraduate nursing students that is admitted to the hospital because of respiratory infections. I know their names. I know who they are. I've sent a message to them saying that I'm thinking of them. So we really try to know who you are and really try to support you, because that is what we believe a nurse should be. Maybe to just add to this is also that you will be working in the hospitals or geriatric facilities from your first year. You need to complete at least more than 2,000 hours of clinical practice. So it's a very practical course. And this will include shifts that lasts for 12 hours. So your feet do get tired. And remember that the Department of Health is responsible for the placement of community service students. And that is, so we send the information through to them, and then they are responsible to place you in a specific setting, which might not include the province that you come from. But like I said, those are actually opportunities for growth. So yes, be us and be part of us. We are looking forward to welcome you. And for any other information or for any other questions that you might have, please contact us and send an email to Mrs. Klopper. She knows you by name, and she really invests in our nursing students. So thank you so much.
Thank you so much, Anna-Marie, for that. That concludes now the Faculty of Health Sciences, all the departments, all their presentations. Just a few more left. Our course support services, Dr. V.P. Wahl. Thank you for your presentation and your time.
Good evening. My name is V.P. Wahl. I'm from the Division of Student Affairs. And so what is the Division of Student Affairs and what is our role within the university? So we take our vision from the vision of the University of the Free State. So the UFS is a research-led, student-centered and regionally engaged university. And our function really is to bring student-centeredness back to the heart of what the university is all about. So what is student-centeredness? Next slide, please. So student-centeredness is simply bringing back the developmental needs of students, irrespective of what it is, back to the heart of the university. So we are here to provide opportunities, to provide support programs, to provide support structures that can be responsive to the various developmental needs of our diverse student population. So how do we do that? How do we deliver being student-centered at the university? We've got 4 key strategic areas that we focus on. The first key strategic area is student success, then student well-being, then student development, and then sorry, you can just pause there, thank you. And then student experience. So let me just pause for a moment with each one of these dimensions of being student-centered. So student success is that we've got a number of programs and a number of support structures that focus on the academic success of students. So we want to make sure that we build the integrated infrastructure of success outside the classroom, working hand and glove with faculties in order to support our students in the best way possible so that they can succeed academically. So a good example of that, the next slide, is the way in which we conceptualize our first year orientation and welcoming program. So you will see that Our orientation and welcoming program is categorized in 3 phases. The pre-registration phase, where we focus on the sharing of information and responding to the questions and needs of students. Then the registration phase, when students arrive here in late January, early February, where we help students to get used to the university environment and get orientated to the university environment. And then once the classes start to take further hands with first-year students in their transition to higher education. The 2 circles on top, or sort of in the middle of the slide, illustrates the different need areas of students as they move from the pre-registration to registration to the transition phases of the welcoming and orientation program. And as those need areas change, different priority projects kick in where we provide holistic and integrated support to support our first-year students optimally in their transition to higher education. So this is one example of how we build infrastructures of success to take the hands of our students and make sure that they are successful in their academic career and their academic prospects. The next slide. The next dimension of student-centeredness that we focus on in the Division of Student Affairs is student well-being. That's represented by the yellow arrow pointing upwards. And in that regard, we focus on the biopsychosocial well-being of students. So that simply means, first of all, the bio aspect of it. We focus on the physical well-being of students. We've got different departments that work on the physical well-being, like COFSI Sport, the Food Environment Program, various interventions that focus on the physical well-being of students. The psychological well-being of students or mental well-being of students is covered by our psychologists and counselors on campus. And then we also focus on the social well-being of students through our social workers on campus. So that's the second dimension. The third dimension is illustrated by the yellow arrow pointing to your right-hand side, and that is student development. That's the third dimension of being student-centered. And in that regard, we provide various out-of-class learning experiences for our students where they can develop what we call graduate attributes. We want to make sure that our students are optimally developed when they finish off at the University of the Free State and enter into the labor and business markets, that they're optimally positioned to make a success of their professional careers. And therefore, we have got a number of co-curricular and extracurricular programs that are intentionally positioned to develop graduate attributes in our students. Lastly, the fourth dimension of being student-centered is what we call the student experience. And in that regard, we also want our students to have fun. So we want to create a sense of belonging and a sense of care at the University of the Free State. Our dedicated student affairs personnel work very hard to create that sense of belonging and a sense of care in different student communities, in our on-campus residences, our day residences, our accredited private residences, our student associations and faculty organizations. So how do we deliver this? We've got various, a large number of functional areas, departments and centers at Student Affairs, and we group all of those into 4 groups or 4 circles. You can go to the next slide. You can go to the next slide. The first circle that we group our functional areas in is what we call the circle of experts. And this circle really refers to the professional and paraprofessional staff members on our team. So in that regard, it refers to departments like student counseling and development. We've got registered psychologists and counselors working there, helping our students. The Center for Universal Access and Disability Support, supporting our students with disabilities. Our social support office, helping students in various ways. We've got social workers working with students. Housing and Residence Affairs, specifically the physical structures of residences on campus, the accreditation of private residences, and the operations, which provides excellent service to our students. The Health and Wellness Center, referring to our medical personnel. We've got medical doctors on campus, nursing staff, a clinic on staff, And so we also provide those services on campus. And then Kovsie Sport, especially high performance sport and the business unit in sport. So one of the previous speakers alluded to the fact that we are currently the Varsity Cup winners of 2024, and we are very proud of big names in the sporting sphere like Wade van Niekerk, Ox Nche, Opa Mahoje, and even Rassie Erasmus has got strong ties with the University of the Free State. The next circle is what we call the circle of educators, and this really refers to those staff members in student affairs that work with the out-of-class learning experiences, making sure that those learning experiences develop students holistically. So we've got a student leadership development office focusing on leadership development, the first year orientation and welcoming program, coupled with the peer mentoring program. We connect each first year student to a small cohesive group of about 8 to 12 students that help them in their transition to higher education. Student media, we've got a radio station on campus, the arts and culture. Last year, our university choir won a gold medal in the European Choir Games in Sweden. So we are doing very well in that regard. The Dialogues Office, Career Services, the Kovsie Act, which is active civic teaching. We've got an eco-vehicle race through the Kovsie Act office, the student wellness program, the food environment program, where we assist students with nutrition, and then Kovsie Sport, where we've got recreational and mainstream sport also facilitated on campus. The third circle is what we call the circle of facilitators, really referring to those functional areas in student affairs that focus on student communities and student governance structures in our residences, in housing and residence affairs, our student governance structures like the Student Representative Council and residence committees, student associations, and faculty organizations. And lastly, the circle of analysts. We've got some staff members in student affairs working with data and data analytics to make sure that what we provide to students, the support and the opportunities, are evidence-based and that we uphold the highest level of professionalism in what we do. Right, so you can go to the next slide and the next slide. And so how does student affairs look like? On top, we've got the Executive Director of Student Affairs, Mr. Themba Hlashu. Then we've got student affairs officers headed by directors on the South Campus and the QwaQwa Campus. And then we've got different departmental heads. On the left-hand side, at the bottom of the screen, left bottom, we've got the head of Student Counseling and Development. Next, we've got the head of the Center for Universal Access and Disability Support. Then we've got the head of Housing and Residence Affairs. Then next, we've got the head of the Health and Wellness Center. Next, we've got the head of Student Life. We've then got the head of Kovsie Sport. Next, the head of Student Governance Office, Institutional Student Governance Office. And lastly, we've got the head for research. So that encompasses student affairs and what we do at Student Affairs, and we're really looking forward to welcome you at the University of the Free State in 2025. Thank you very much.
Thank you so much, Dr. Wahl, for the presentation. Before we get to the Q&A, our last unit is the student accommodation. I'm going to hand over to Vensie Mapupa for our presentation here.
Good evening, ladies and gentlemen. I apologize. There seems to be just a few issues with my camera. But thank you so much for this opportunity to be part of this amazing virtual engagement. As said earlier, my name is Vensie Mapupa, and I work for Housing and Residence Affairs in Accommodation Administration. We are responsible for the applications and the final placements of students in our on-campus residence. So if a student, a prospective student, would like to be part of on-campus accommodation, on the application form online, there is just that one question where they are asked for you to indicate whether you would like to reside in the on-campus accommodation. And then once a student ticks that, a housing offer is only sent to students who have been accepted into an academic program. So what happens is a student then goes through the selection program process, academically, and then once the students have been accepted, we then receive the data of all the students that have been accepted into these specific programs. Then once a housing offer is then sent out to a student needs to have a 980 to pay, and that is you confirming your placement and accepting the offer that has been sent from our office. We have also made provision that if a student cannot afford the 980, it can be paid in 2 installments. Next slide, please. Now, we've got a few requirements for students who wish to stay in on-campus accommodation. I'm going to focus on the Bloemfontein campus because that's where we have our health sciences students. A student needs to have an AP score of 30 and above to qualify for on-campus accommodation. So sometimes a student will then apply with the grade 12 results, grade 11 results. So the final outcome of the results will really determine whether the student can actually take up the space that has been offered to the student. Next slide, please. Can I just mention here that also what we have done within Housing and Residence Affairs, we do what we call faculty-based placement. So for health sciences faculty students, they are placed in the East College. And in this East College, we've got 3 residences. We've got Rosemary, which is for females, and Kyalami, which is for males. And then we've got House Adder, which is a co-ed. Co-ed meaning we've got 1 block for males and 1 block for females. Next slide, please. Also, just to mention here that all first-time entering students are accommodated in sharing rooms. And as the years go by, the students then have an opportunity to apply for single rooms within the residence space. Currently, the pricing or the cost of residence on the Bloemfontein campus is varying between 33,390 to 47,980. I also just want to mention here that all our residences are self-catering, meaning students have to cook for themselves, but students also have the option of uploading money on their student cards, and they can buy food at the cafeterias, which also have healthy options available. Next slide, please. Next slide, please. Next slide. Okay. So usually people will ask, what do I bring along to the residence? Once a student has received a housing offer, they have signed the undertaking and sent back the undertaking with a proof of payment of the 980. We then do the final placement, and then the names of these particular students are then sent to the respective residences which have been allocated to them. Now, before you move into a specific residence, you need to know that the room has a single bed, study table, a chair, a cupboard for food, a wardrobe for clothes. So meaning the students will have to bring everything else for themselves. We're talking in terms of your bedding and curtains for your room, a microwave, a kettle, a bar fridge, pots, pans, everything. You are literally starting a little home away from home. Next slide, please. So you are looking at things as well as your study lamp, small dustpan, an iron, a broom, cloth, a padlock to lock your cupboard during holiday, a desk fan in those days when it's hot. All our rooms have heaters, which are switched on just before winter starts, so you don't need to bring a heater to your room. Little plugs. So basically, like I said, you are just starting a little home away from home. Next slide, please. You are also bringing along sports gear because once a student moves in, there's usually activities that take place within the residences during this first week or 2 weeks when the students arrive on campus. You're looking for comfortable shoes as well, because you're going to be walking. For health sciences students, they're very lucky because the East College is close to their faculty, so their classes are just within the range. So they don't need to walk very far. Can I just mention here that I will put in the chat box our email address. So if a student has applied and has not indicated on the application form that they are interested in on-campus accommodation, they can just send us an email. I'll just say out the email address here, resapplications@ufs.ac.za. And then you can just send us your full name and surname with a student number, and we then can put in an application on your behalf. And once the application has been processed and finalized, we'll then send you an email with all the relevant information. Thank you so much.
Thank you so much, Vinci, for that. Ladies and gentlemen, thank you. We are at the end of almost at the end of the program and of the evening. There's going to be a Q&A session now. So if there is an important question that you would like to ask some of our panelists, please just raise your hand. There is a button there at the bottom where you can raise your hand. I'll acknowledge you and you can ask your question. We're going to spend more or less 10 minutes on this before we close off the evening for that. So if there's a question, just raise your hand and we'll acknowledge you. Thank you. Hello, sorry. I've got you. Is it Fanali? Sorry. Yes, you're not that audible.
Sorry?
Okay, just we're gonna try. You're not that audible. Just speak nice and loud.
Oh, okay. Let me try to do like this.
Can you hear me?
Yes, now we can
Yes,
hear
can
you.
you
Can
hear
you
me?
ask your question? Yes, please. Thank you.
Yes, I am Fanelus Bonge Biera, and I'm currently enrolled at UKZN for Bachelor of Science, and I am the first year student, and I'm interested to come and study to do physiotherapy or radiation therapy. How can I apply? And what are the minimum requirements that I'm supposed to meet as I am in another institution?
Okay, thank you for that question. I think you posted it in the Q&A section as well. I think Noms, ma'am, sorry, did you answer that one? Can you assist us there? Hello?
Yes, Miss.
Yeah, sorry, I'm referring to one of my panelists, one of my colleagues.
Oh, okay.
Is there anybody from the faculty that can help me? Physiotherapy. So it's a first year student at UKZN, wanting to transfer to the University of the Free State into physiotherapy. Just want to know the application process and the minimum requirements. The minimum requirements, I can tell you now, would be the minimum requirements that's in the prospectus as well. So it's going to be according to your final grade 12 marks that you meet the minimum requirements for the program stipulated. And then also we're going to have a look at your study record at the other institution where you are studying at the moment. Am I correct in saying that? Sorry, can one of the colleagues maybe just help me here from the Faculty of Health Science, please?
Hi, Reinhard. It's Taneo here.
Hi, Taneo.
Yes, so it is, you are correct. So he needs to be applying with the results from his first year. He says that he's currently in first year, and all the applications are being done online. So he will need to go onto the portal, the UFS portal, and apply online, and then submit all the necessary documents that will be needed, and then we will take it from there.
Thank you
I
so
don't know
much.
if that answers his question.
Yeah, that's good. Thank you very much. Vanalese Bonge, is that sufficient
Yes,
for you?
yes, it's fine, it's fine.
Okay, thank you so much. You can lower your hand when you're done. Thank you very much. Any other questions from the floor?
And sorry, quickly, Reynard, I think just to
Yes.
clarify, may he please just make sure that he does the application before the 31st of May, because the applications close on the 31st of May.
Okay, yeah. I hope you got that, Vanalise, that you must apply before the end of May, please. Before the closing date. Is there any other questions from our attendees for tonight's session? Okay, we've got a hand there. Just give me a moment, sorry. Vanalise Bonge, it's you again.
Yes, I'm having my friend here. So he wanted to ask that, okay, he wanted to ask that how many are the minimum requirement of optometry? He's also enrolled at UKZN.
Okay, so the minimum requirements for optometry is an APS score, admission point score of 33 points, and then a minimum subject percentage of a level 5, that's 60% for your mathematics, life science, and physical science. And then also, if it's a current student at another institution, the final grade 12 marks will be taken into consideration, plus your study record and your marks that you are busy with in the institution that you're studying with at the moment.
Oh, okay. I think he's saying that he's qualifying because he has a level 6 for physical sciences and level 7 for mathematics.
All right, yeah. Then you must just apply online before the end of May, please, with that, and upload the documents for us there.
Okay, so as we are in another session, how can we upload our academic record if we have received them, or you can capture it will be captured by you?
There is an email address that the faculty has where you can email those documents to the relevant personnel that do process the applications. So once you applied, that communication will be done with you once you applied on the system.
Or as soon as I'm done, as soon as I've received my academic record, so I'm supposed to email it to them.
Yeah, you're going to first apply on the website before the end of May. You're going to submit your application with your final grade 12 marks, and then the communication from there on from the faculty will be to get access to your study record and your marks that you've obtained at the other institution where you are studying.
Okay. Thank you a lot, sir.
Okay. Sorry, Nick, I see you've got your hand up. Do you want to maybe elaborate on that?
Yes, thank you, Reinhard. I just would like to mention, am I audible?
Yes, you can go ahead.
I just would like to mention, because I've heard the request and the responses, please take note that although they might meet the requirements, meeting requirements does not mean that you are guaranteed a space in the program. There are a lot of applicants and a lot of them perform very well. So just meeting the requirements does not mean that a student will be accepted in the program. They just need to take note about that as well. That's all I wanted to say. Thank you.
Thank you, Nick. Yes, as all the presentations actually tonight refer to the selection policy. So it will still, you need to adhere to, or we'll still go through the whole selection policy of the faculty and the program. I see there is a hand, Kopo Ramakwena. Kopo
Good evening,
Ramakwena.
sir.
Yes.
Am I audible?
Yes, I can hear you.
Okay. I wanted to ask, between senior students, how many choices are they given when applying?
Sorry, just say that again. How many?
How many choices are they given to apply for? Maybe a faculty or a course. Are they given 2 courses like students from matric?
Well, if you apply for the first time, are you a postgrad student or applying for the first time?
No, I'm currently a tertiary student.
Sorry, you're currently?
A tertiary student.
Okay, I
Great.
see. Yes, ma'am.
Can you hear me?
Yes, I can hear you now.
Yes.
Good evening. Hi. You have 2 choices like all other students. So you need to choose choice 1 and choice 2. And as it was mentioned in the presentation, if you want to do any program in health sciences, it needs to be choice 1. The second choice is not going to be considered. So you need to make sure that whatever you want to study, if it is within the health sciences faculty, that is choice 1. And then the second choice can be in any other faculty at the university.
Okay, ma'am. Thank you.
All right, we're gonna take one more question, Leia. Leia Botma, I see your hand is up. We're gonna take one more question and then we're gonna end off the evening. It is getting late. As I mentioned, we do have the recording. We do have your contact details. And we will send the recording to you once we're done with this evening with this webinar. So Leia, maybe we can end off the evening with you with your question, please.
Am I audible?
Yes, I can hear you.
Okay. I think there was someone else that also asked this question, and they also answered the question now again. But for a second choice, if you're not accepted for MBC HB, what would be a good choice to have as your second choice that you can maybe move over to medicine later on? They answered here BSc, but which one of the BSc degrees would be a good choice?
Okay, ma'am, I see you've got your hand up.
I've
Thank you,
had
Leia,
this
for that question.
Thank you, Rainey. I've had this conversation with the dean of the faculty at some point because there was a problem. And his response is, it really doesn't matter. You need to be able to do a program as your second choice that you are also passionate about, just in case you are not able to get into medicine. The important thing is you need to pass all your modules exceptionally well. And I think they mentioned 75%. You need to be able, your average needs to be 75% and above so that you can then be considered. Remember, you are now considered a senior student and we only have 10 spaces, I think, available for senior students. And we choose the best of the 10 students. Do you
Okay.
understand?
Yeah,
Right.
I understand. So only 10 then get chosen. Okay.
Yes.
Thank you.
Thank you so much, Leia. Thank you, ma'am. I think, ma'am, whilst you're on the floor, do you would like to end of the evening for us?
Thank you so much, Rainey. And thank you to our parents, our participants, our prospective students. It's an absolute pleasure for us as the University of the Free State and Student Recruitment Services to host you for this evening. On the chat, I did post towards the end some of the very important things that you need to take note of, and our sincere apologies for the questionnaire that has been missing. And I thought that the questionnaire was already uploaded on our various web pages. By Monday, we will need to make sure that that is done. Thank you for taking this time to be with us today. I trust that the presentations that we made today provided you with valuable information. And if you have any questions, do not hesitate to contact us. We will send the recording to everyone that has RSVP'd. We do have your details. A very special thank you to all our academics and all our presenters this evening. Thank you so much, Prof. We know that you are really busy, but you took this evening to be with us today, and to all our academics and all our support staff that are participating today. It really is really appreciated that you were able to provide your time and be with us. Thank you so much. On that note, good evening. Thank you, Rainy.
Thank you, Namondi. Thank you, Reinhard.
Thank you, everybody. Good night.
Good night.
Good night.
Good night, colleagues. Thank you so much.
It's a pleasure. Guys, thank you so much. Good evening. Baran, you're a star. Karin, you're a star. Thank you so much for all your work and all your trouble. Good night, guys. Yo,
Thank
it's
you,
been a long
Namondi.
day. Ruru, thank you. It's been a long day. Good evening, guys.
Everyone.
Thank you.
Bye.
Goodbye, man.